Increased government spending. Universal healthcare requires significant government funding, which may lead to higher taxes or reallocation of funds from other services. Overuse of medical services. When healthcare is free at the point of use, there can be overuse of medical services, straining the system unnecessarily. Stifling of innovation. The reduction in competition due to universal healthcare can lead to less innovation in medical technologies and treatments. One-size-fits-all approach. Universal healthcare systems may struggle to meet individual health needs with a standardized approach to care. Increased wait for new technologies. The integration of new medical technologies and drugs can be slower in a universal healthcare system due to extensive regulatory hurdles and budget constraints. Reduced incentives for professionals, lower potential earnings, and increased workload may deter skilled healthcare professionals from entering the field or encourage them to move to countries without universal healthcare. Privacy concerns. Universal healthcare often requires extensive data sharing and record keeping, raising concerns about patient privacy and data security. Long wait times. In many universal healthcare systems, high demand and limited resources leads to longer wait times for treatments and procedures. Limited doctor choices. Patients may have fewer choices in selecting their doctors or specialists, as government plans often assign healthcare providers based on availability rather than patient preference. Potential for decreased quality. With an emphasis on cost control, the quality of healthcare services may decline as providers may be incentivized to cut costs. Cost overruns. Government healthcare programs often face cost overruns due to underestimated demand and rising health service costs. Political manipulation. Healthcare policies and funding can become tools of political manipulation, influenced by changing political agendas rather than patient needs. Dependence on the state. Universal healthcare makes citizens highly dependent on the state for their health needs, potentially reducing personal freedom. Limited access to elective procedures. Non-essential or elective procedures may be limited or not covered under universal healthcare, forcing patients to seek expensive private treatment. Economic disincentives. The high taxes needed to fund universal healthcare can create economic disincentives for businesses and individuals, potentially slowing economic growth. Resource allocation issues. Deciding how to allocate limited medical resources can be challenging and controversial, potentially leading to suboptimal care for certain conditions. Impact on private sector. The introduction of universal healthcare can disrupt existing private health insurance markets and medical providers, leading to economic consequences. Moral hazard. The assurance of healthcare might lead people to engage in riskier behaviors, knowing that the healthcare system will provide for them. Next up, I have every argument for universal healthcare system. Click the video on screen now to watch that.